Hi, I'm Dr. Jay Hall. The hearing screening method we're going to review in this video is the Pure Tone technique. In this video, I'll talk about Pure Tone hearing screening with the GSI-18 screening audiometer. There are a few important steps for you to consider before beginning hearing screenings, particularly at a new venue. First, make sure that you're in a quiet area. There's a quick and simple way to verify that the test venue is quiet enough. Place the earphones over your ears or on the ears of a coworker or colleague who has normal hearing sensitivity. You or the other person should be able to easily hear each of the Pure Tone signals when they're presented at an intensity level of 10 dB. Second, place the audiometer on a table not too far from a power outlet. If a power outlet is not available, you have the option with the GSI-18 audiometer to rely on battery power rather than a power cord. Third, make sure the earphones you want to use are plugged in completely and correctly into the panel at the back of the audiometer. If you have the option for a patient response button or a hand switch, make sure the cable is also plugged into the proper receptacle on the back panel. There are two important steps for you to take before you conduct Pure Tone hearing screening. First, conduct a brief inspection of the child's outer ear and ear canal. With a smile on your face, mention to the child that you'll need to take a quick look at each of their ears. Make note of anything unusual or unexpected, such as growths, evidence of injury, atypical shape or position of the outer canal, small pits in the skin or skin tags in front of the ear, and also look for debris, cerumen, or foreign objects in the external ear canal. Next, before placing earphones on the child, you need to give a brief and simple explanation of the Pure Tone test process. I have found the most effective instructions are something like this. Sam, you're going to listen for some beeps. Some of them will be low, like thunder, or a man's deep voice, and some of them will be higher, like a whistle or a bird chirping. The beeping sounds will all be sort of quiet. Every time you hear a beep, even if it's soft or far away, raise your hand. Let's practice. After the task has been explained, it's time to place the earphones. For most screenings, you will use over-the-ear headphones. Proper placement is critical. The headphones are marked for each ear. Ensure that the red earphone is on the right ear and the blue earphone is on the left ear. When placing them on a student's head, adjust the headband to ensure that the center of the earphone is over the opening of the ear canal. Alternatively, insert earphones may be used with the GSI-18. These are also marked for each ear. Ensure that the red insert is on the right ear, the blue insert is on the left ear. Place inserts into the ear, select the proper size foam ear tip. The brown pediatric size is usually appropriate for young children. Insert the black tubing of the foam ear tip completely onto the nipple of the sound tube. Then roll the foam tip into the smallest diameter possible. Insert the ear tip well into the ear canal and allow the foam to expand to acoustically seal the ear canal. Discard foam ear tips when the test is completed. Pure Tone hearing screening has for many years been the most popular technique for detection of hearing loss in preschool and school-aged children. Pure Tone hearing screening of each ear is typically performed with 3 test frequencies, 1000 Hz, 2000 Hz, and 4000 Hz, that are presented at 20 dB HL. However, recent research shows that including a 6000 Hz tone increases the chance of detecting a high-frequency hearing loss in older children. The hearing loss in older children is often associated with excessive noise or music exposure. The Pure Tone hearing screening protocol that will be used in this series is based on recent research evidence. With this protocol, pure tones are presented at 4 frequencies: 1000 Hz, 2000 Hz, 4000 Hz, and 6000 Hz, all at an intensity level of 20 dBHL. The technique for pure tone screening is to first test the right ear with each of the 4 tones, and then the left ear. There are 2 options for how children can indicate that they hear the sound. One is to press a response button, and the other is to raise a hand whenever a tone is heard. To pass the hearing screening, a child must respond to each frequency in each ear. Remember, even if the child does not respond to a single frequency in one ear, the screening outcome is a refer. The pure tone test technique is generally a feasible option for hearing screening of children aged 7 years and older. However, it's not always possible to complete valid pure tone hearing screening for young school-aged children, including those in kindergarten. Pure tone hearing screening is not a feasible option for preschool children. Like all behavioral hearing tests, the validity of pure tone hearing screening is influenced by listener variables, including the child's ability to understand the task, motivation to cooperate, and cognitive factors such as attention and memory. If a child cannot or will not participate in a pure tone screening technique for any reason, then you have the option of performing hearing screening with a combination of DPOAEs plus tympanometry. I review each of these objective techniques in separate videos. Pure tone hearing screening can be challenging, so I'm going to offer you 6 tips and practical suggestions. First, a small proportion of children will not pass pure tone hearing screening. Don't repeatedly present any of the tones if the child fails to respond the first time you present them. Also, never increase the stimulus intensity level above 20 dBHL. Second, set up the screening venue so the child is seated facing away from you rather than looking directly toward you. It's important to avoid any opportunity for the child to pick up on cues when you present the tones. Third, insert earphones are an option with the GSI 18. If the ambient noise levels in a screening room are not ideal, conduct the listening check using insert earphones. If you or a coworker can easily hear each tone at 10 dBHL using the insert earphones, then you should use them for hearing screening. Fifth, the button press response option is preferable to a hand-raising response because you don't need to look at the child every time you present a stimulus. Instead, you can look for the response on the display of the audiometer. Finally, don't forget to clean with a sanitizing cloth the earphones and the response button after screening each child. We've just discussed how to perform successful pure tone hearing screening for your screening program. There are a number of additional resources available to help you learn more about pure tone technique, use, and interpretation. I would encourage you to take a deeper dive by reviewing the equipment tutorial videos available with this video.